Welcome back to Good Morning Sri Lanka on a Thursday morning. We are here with Dr. Harindu Vijay Singha, and who is of course familiar to Good Morning Sri Lanka as he has been on a few shows here with us, advising us in the past. We did have a long conversation with him about, actually I did have a long conversation with him about back pains, and now we are going to shift the topic into knee pains. And of course, doctor, during the first segment you told me that a lot of people suffer from back pains. There's like about, in the US alone, there's about 80 to 90% of people suffer from back pains. You said, how is it with knees?
Knees are also pretty high up there in numbers, and knee pain is very common, and I think it's very common in Sri Lanka.
Okay.
Because the knee is one of the joints, like the lower back, which takes a lot of the weight. The knee also takes the brunt of our weight when you're walking around. And we see a lot of people with knee problems, and it's not only elderly people. We see young people, especially sports-related injuries, because the knee is very commonly injured in sports also.
I see. There are a few diagrams which you've brought to us, doctor, and this is one of the diagrams.
So that's
the
structure of the knee. You can see three bones actually: the thigh bone, the shin bone, and your kneecap. That's what makes the knee up. And you have these various blue color pieces which are cartilage, and these are the pieces which let the knee bend and extend without any problem. And that is the commonest thing that gets injured in the knee. Also, you can see those various ligaments there. We call the ACL ligaments and the lateral ligaments, which give the knee stability, and all of this is covered by a whole heap of muscles. So this is the basic structure of the knee.
I see. And doctor, what causes knee problems usually?
There are several different causes for knee pain. The commonest problem would be wear and tear of the cartilage, which we saw. We saw those three bones in the knee, and in between that you get wear and tear of cartilage. It's very common as you grow older, and we call it osteoarthritis of the knee, and it leads to various creaking of the knees and pain and filling of water in the knees. Next we see sports injuries, which mainly injuries to the menisci, which are also a type of cartilage found in the knee, and due to various twisting.
I think we also have a few diagrams on that as well, in terms of what causes these common causes of knee injuries.
This is actually a picture of the knee where the cartilage is worn. You can see the red color, the smooth surface is replaced. So this is what we call a patient with osteoarthritis of the knee, and this leads to various different types of pain. As I mentioned earlier, initially you feel just like a creaking sensation in the knee, followed by more pain. Initially the pain might be just when you go up and down a step, but later on this pain actually progresses on, and you might get pain while walking, and as it progresses more, water will collect inside the knee and you might have difficulty in walking. So these are the various stages of progression of what we call knee osteoarthritis.
Okay, and I believe, doctor, arthritis is a very common problem here in Sri Lanka. What really causes arthritis, really?
Actually, the term arthritis involves about 200 different diseases which involve our joints.
Oh.
Right. So it's not one disease. There are a lot of different diseases, and when we tell what a joint is, I think we showed a structure. Joint is in a place in our body where two bones meet, and in between the bones you have cartilage, which lets the joint move, and it's surrounded by ligaments which support it. So in arthritis, these 200 different diseases which affect it, there are only about 4 or 5 common ones. And the commonest is the wear and tear of cartilage inside the joint, which we call osteoarthritis. Second on the line would be the sprains to the various ligaments and muscles around it. We call it strains and sprains. So those two would encompass about 80 to 90% of these problems.
I see.
And these are followed by the more serious forms, which we call the inflammatory arthritis, the rheumatoid arthritis, psoriatic arthritis, where the body's own cells come and start destroying joints.
I see.
So that would be our third, and then you get these various diseases like osteoporosis, cancers, which can occur in the joints, which are not so common.
And doctor, how are these knee problems diagnosed?
Well, it's basically on pain. So a patient will complain of pain in the knee, And then when you come to the doctor, what we'll do is we'll take a history, or we'll ask you how you got the pain, how long have you had it, was there any event which caused it. So there are various things that we will ask for. And then we would examine the knee. We would take a look, and we have various tests to check the cartilages, the ligaments, the muscles, what it caused. And based on this, we come to a diagnosis. We can get a diagnosis in most instances just by doing this. If you want more information, we'll do some blood tests.
I see.
Go on to doing x-rays, and of course if we still don't have the answer, MRI to look at it properly.
I see, but with all this then you'll finally figure it out, right?
Well, yes, we can tell you there's nothing majorly wrong even if you don't find
you're
it
just
out.
psychologically thinking that there's pain. Cool. And doctor, how can people prevent these knee problems?
Yes, I think it's a very important question because it's easily preventable. Now, there is a various genetic component of wear and tear of cartilage and age. Those two factors we don't have in our control. But what we can do is, one is maintain your weight. I think for knee that's number one. Number two is postures. Like the back, for the knee, posture is very important. One is you should avoid excess standing and kneeling, which is very bad for the knee.
I see. And how do you treat knee problems in general? If you suddenly have a knee problem, what was the first thing you should do? Now, I think we have a diagram also, doctor.
Yes, so it shows somebody icing a knee, and the next diagram shows a steroid injection being given to the knee. So these are again, along with tablets, pain relieving methods to reduce the pain in the knee. And then of course we have to find the problem out. In the meantime, this shows the muscles in our body. Around every joint there are muscles, and one of our main treatment aims in knee problems is strengthening of muscles around the knee. So there are various exercises which you can do. These are very simple exercises which you can do in a chair. Going on to more advanced exercises which you can even do in a gym, which to strengthen the muscles.
I see.
So these are like squats, like leg pressure. And along with this, of course, you have to find out, as I said, there are a lot of different types of arthritis, whether this is osteoarthritis, whether this is a rheumatoid, and find out the cause and then start treatment on the root cause while you do all this.
I see. Well, thank you very much, doctor, for being with us. Unfortunately, we are out of time. For back pain and knee pains, any general advice you can give our viewers?
Yes, I think exercise properly, maintain weight and proper posture.
I see. So we're talking to Dr. Harindu Vijay Singh on back pains and knee pains. Thank you very much again for being with us once again on Good Morning Sri Lanka. Unfortunately, it's time to end this segment with you, and I'll be saying goodbye to you as well. But of course, we're not done with the show yet. Amaya will be coming into the studio, and she'll be having a chat with the crew who are the organizers of the edX Fair. So stay tuned for that. Thank you, doctor. Good morning to you, and I will see you later. Amaya is coming, so don't go away.
Good morning, Sri Lanka. You're back with me, Amaya, after the break. Now, I've taken over because we are going to speak to you this Thursday morning about something very special, a segment that we had earlier on in the week as well, and we are continuing to speak about that, which is about the edX Expo, which is happening here in Sri Lanka and in Colombo on the 17th, 18th and 19th of January, and the 24th and 25th of January at the Kandy City Centre. And this edX has been something that has revolutionized the way education as well as career development happens here in Sri Lanka for the past decade now, and this is the 11th time that this program is happening here in Sri Lanka. It has really changed the way that students look to their future and the options that they have presented to them for their future. And in the words of the chairman as well as the founder of edX, it is a social enterprise which is done by the Royal College Union, and it's something that has benefited many thousands of students across the island over the past decade. So I have the gentleman with me here this morning as well, the chairman as well as the founder of edX, Mr. Kamal Abesinghe. Good morning, sir.
Good
Welcome
morning.
to the show.
Good morning.
And I also have the director sales of edX with me, and he is Mr. Ranga Vijay Singh. Good morning, Ranga.
Good morning to you.
Welcome to the show, gentlemen.
Thank you for having
some of
us.
your colleagues, it's a great pleasure to have you here with me this morning as well. Some of your colleagues were here with us on Monday morning as well, sharing some details about edX Expo. But we have you here, and you're the main man here that who spearheaded edX 11 years ago. Now it's come to such a great place here in the Sri Lankan Education Forum. But let's speak about the thought process that you had behind edX when you started it up, sir.
Actually, to start with, I'm just one person in a team of volunteers. Actually, 11 years ago, if you go back to the landscape that existed, I believe there were few preferred choices of employment, like to be a doctor, engineer, lawyer, or an accountant, the traditional.
That was pretty much in the pathways
Yes.
that were available.
So we observed that the landscape was changing very fast with the advent of technology. New opportunities were emerging, new career pathways were emerging, and of course there were the places in our local education system, especially in the university segment, was limited. Still, I think something has, the numbers have increased to some extent even as of today, but there were like emerging opportunities which people were not aware of. The students, parents, even educators were not aware of. So we thought we should create a platform where all these post-secondary educational service providers can be brought together and offer all these opportunities on a single platform, so that the aspiring youth, those who complete the secondary education after O-level, after A-level, can come there and have a one-to-one interaction with the service, those who offer such services, and then decide what is best for them, depending on their likes as well as their capabilities, So that's how this was started. That was 10 years ago, and since then we have brought in very value additions every year, and today I think we can offer a very comprehensive range of choices, options, opportunities, offering connectivity, connecting the dots from education to employment comprehensively. So I think we'll talk about it. We'll even offer...
It's a very innovative new thing that has a new concept that has come up through edX, and it's just a natural evolution of what edX was 10 years ago and what it is now, isn't it, sir?
Yeah. I would say a thoughtfully crafted natural evolution.
Okay.
It won't happen just...
It won't happen just... That's true, that's true. There have to be people behind it driving it for that change to happen. But that's what you've been doing with edX so far. And
that is why I said I am only one person of a team. There were hundreds of volunteers who are contributing to enrich what we offer to the youth in this country through edX.
And what's the response been like? I mean, for you personally, your ideas on the response that students have been giving you towards edX?
Well, I believe looking back every moment, it's a very, very fulfilling, thought process that crosses our minds, looking back where we were, what we have offered, how we have transformed the destinies of, so many hundreds of thousands of youngsters in this country. I believe if you put together last 10 years, there have been over 500,000, over 500,000 visitors to edX, both in Colombo and Kandy, and the numbers are growing because the aspiring youth, the aspirational aspect is growing among the youth. So they are looking for opportunities, so we have been able
to... edX is there to cater to those opportunities.
Exactly.
So that's amazing. But a question that has been niggling in my mind, and Ranga, I'm going to pose that to you, is how do you choose the sort of post-secondary institutions which will be represented at edX? And do you have a sort of strict policy when it comes to who is there, who is part of edX Expo, and offering these options to the students?
Yes, we do have a process. We do our due diligence, and then that is because we harp on quality, because that's what edX is.
Yes,
that's what edX is. So we do have a process where we take a newcomer, so to speak, a new course provider. We take that institution through that due diligence process, and then only we allow them to display themselves at edX.
Right, so the quality control is, of course, something that you look into very strictly, is it?
Yeah, within the limitations of a voluntary organization, yes, we do all that. But I believe the real due diligence should happen with some authority. Unfortunately, that kind of authority